Christensen. How are you? I had an inspiration to give you a little bit of some discussion about those frequent questions that we often have about our children. And today would be when to see the doctor. Of course, we see children all the time for their well child exams, the regular scheduled ones. But you know what is really more concerning is going to be when your child is sick. And when do I see the doctor when my child is sick? You know, the first thing would be that your child is sick, unfortunately, quite often, especially at daycare and school. Throughout the fall, winter, and spring, this is something that is always something that everyone has to deal with. Now, cough, congestion, runny nose, mild symptoms that go away after, let's say, 3 to 4 days, or maybe even up to 7 days, that's okay. You know, if things are relatively okay with eating, playfulness, and sleeping. But if you notice that your child is having difficulty to the point where they have a cough that's not getting better more than, say, 2 weeks, this is something that is quite concerning, and the doctor probably should know about that. Also, if your child has other things with the cough, let's say a fever, a cough that makes it difficult to sleep, makes it difficult to just to do playful things that they normally would, then this is something that would be something to have the child see. Now, if the cough is then developing into more of difficulty with breathing, of course, this is something where probably we reserve the determination that the child should see the emergency room. Now, what can you see in your child when they're having difficulty with breathing is that they're working hard to breathe, and that their respiratory rate is also quite fast, along with that difficulty of breathing. It's faster than they normally would be if they were sitting down, and they're using muscles when they take a deep breath in that above their rib cage and below their rib cage, that they're actually having an area of the body sucking in when they take that deep breath. Those are just red flags. Go to the emergency room, don't wait, and have your child checked and make sure that they're doing okay. And to have probably some emergency services provided to help them do better. Other things that are concerning, you know, is that you have a child with a fever that doesn't go away. Maybe everything else is quite mild. If the fever accompanies other things, let's say a fever that is, let's say, painful with urination, the child's complaining of that, of course that needs to be seen by a doctor. If the fever has gone more than 5 days in a row, then of course the doctor needs to be seen. And if the fever is associated with any pain, so abdominal pain, chest pain, headache, even a mild headache, it probably needs to be looked at by a doctor. Now, if they're more severe pain, of course, you would see the doctor right away, or go directly to the emergency room. Another common, which is not necessarily an upper respiratory infection, but another common thing is vomiting. So a gastroenteritis. A child that's vomiting and it doesn't look yellow, it's just clear liquid, and they're throwing up. You can take good care of them by using any fluid really, but probably Pedialyte would be the best, or a Pedialyte equivalent, and giving them small amounts, let's say 1 ounce to 2 ounces every 20 minutes, will be just like going to the emergency room and having an IV. And you can help your child, even if they throw up again and again, you can get fluids into that child and make sure that they're doing okay. Now, how do you know they're doing okay? You can look at their mouth and see if it's tacky or wet, or the most accurate way, of course, to know when your child is getting enough fluids, even though they're having diarrhea or vomiting or both, is that your child is having regular voids. About every 1 to 2 hours is fantastic. But if your child is going beyond, let's say, every six hours and not having a void, this is something where you need to go to the emergency room for IV hydration or other services to make sure that your child is okay. Now, we've talked about all of these great things, when to see the doctor, and of course, if I mentioned go to the emergency room, go to the emergency room, please. But besides that, we can take care of you in this telemedicine practice, or we can use in person in the future to see your child. So I appreciate the talk, and thank you very much.